Okay.
Good morning, everyone. We're going to go ahead and kick off our series on global women's health, women, girls, and relatives. We are looking forward to designing and really building out this initiative with multiple different topics related. I believe health is in every aspect of policy. Every policy taken challenges women and girls and generations in different ways. And so we'll be looking at different dimensions of that throughout these series. Today, we're going to start focusing, giving kind of a background, global layout of what's to come and what challenges are existing. And then Nershella will take it away and talk about Medicaid and the impacts in the United States. So I'll give a very robust kind of idea of what challenges are, a couple numbers just to give some perspective. But I do foresee in the future bringing other specialists in that focus on health related initiatives, but also bringing in very different types of data and modeling and workshops so that we can kind of see long-term impacts. And so as you answer your favorite fall autumn foods, we'll start with quick introductions, and I'll go ahead and give it to you, Nershella, and then I'll follow up introducing myself if you want to go ahead and.
Thank you, Carmela. Well, happy Saturday, everyone. Thank you for joining us. I'm Sheila Chand, and I am based in California in the Bay Area. And I'm a public health care practitioner in the non-clinical side, I always say. So I specialize in population health, community health, and also women's health as well. I have just become really fond of all of the different um, initiatives that are taking place in women's health at the moment. And also I mean, we'll get more into it with all the policy landscape, but also the amount of services we currently need to still support women in the long term or as throughout our entire life stage. So I'm really excited about I'm still very excited about all the innovation that's happening in women's health and in public health, as well as sort of the people that are still taking on these courageous, bold moves to build out services that are truly impacting women all over the world, despite the fact that there are policy changes, funding cuts, but they're still advocating, they're still building in whichever way possible, and still bringing in a movement of women together, just like women graduates here. And I have been a part of the organization for some time. Due to Faye Weber. She's the one who was very inspirational in getting me to come on board. And I am very excited to be here and also to lead the initiative, the Reviving the Global Women's Health Workshop. So we're excited to sort of see all the different ways that we can broaden our scope in women's health, as well as also support the different types of leaders and individuals and within our organization that are working on some amazing projects. We really want to highlight them within this workshop series. So we're starting it off with both Carmela and I, and excited to be here. So I'm going to give it over to Carmela now.
Okay, I'll do a brief introduction, and then is there a slide before this?
No, this was it.
Okay, no problem. I'm actually, okay, I'm not sure what got onto the slides or not. However, so my name is Carmela Roybal. I am a medical sociologist by training. I work in bioethics and global public health, specializing in healthcare delivery and many other aspects of health related to women and indigenous communities globally. Just in a nutshell, I also serve and wear several hats and work closely with tribal and indigenous peoples initiatives across pretty much the world to come up with innovative solutions to understanding and bringing solutions to some of the issues that we're facing. And so a lot of my work starts out in a data kind of world, trying to build out landscapes, build different initiatives around that, and then moves into other actionable items and initiatives that we roll out. So I am the executive director of the Native American Budget and Policy Institute, and I'm also a senior advisor in the Agency for Healthcare Research and Quality, leading tribal initiatives. So today I'm going to give just a very brief landscape. I am not sure what slides made it on, or I did correctly because I usually don't use Google Slides. So I try to transport these over. So we'll just kind of walk through them. But here are a couple items and areas of that will are going to be worsened, and areas that are going to be needed to focus on. So in the future, some of these areas will kind of cover through our workshops. So these are the top um, global areas that women are effective. So food security, nutrition, um, and here and then you can kind of see us toggle back between global and local. So SNAP, there's going to be major impacts. We're not going to talk about that today, but I wanted to put that out there. So when we think about food security, women who are disproportionately in children, this is also going to be in changes, although we're going to focus on Medicaid just for the breadth of the topic. But there are very other really important areas that we can talk about when we think about intergenerational poverty and the reproduction of that, because all of these are going to affect women and kind of build that out. So administrative burdens, worsen financial vulnerability, and definitely we want to do something in the future talking about the impacts on caregivers and what that looks like. And then if you can change
Yep.
the slide.
Oh, there
There
you
we are.
go.
So that's actually the first. Yeah. Go
Oh,
ahead and pass that
it
one.
switched over. Okay.
Yeah, it's switched over, so that's no problem. Okay, go ahead and go to the next. So U.S. and global challenges to women's health, really important. We're going to focus on health coverage loss, um, reduced access to reproductive health, all of the different implications that come with that. And Rochella will cover that. But we understand that women and girls are uniquely vulnerable to these legislative cuts. We are going to see many different changes. We're going to think, we need to be kind of on the cusp, understanding the locations, really understanding the long-term implications. On the global stage, we're going to see a lot of changes and the impacts that it's going to have on the larger communities. And you have all seen that with USAID cancellations and the future of what that's going to impact. I want to give you a few numbers that I have here, what's expected. So it could right now it's estimated that over 14 million additional deaths by 2030 with that cancellation. So on the global sphere, there is a major impact. And although we're not going to drill down, we're looking at over the course, of so many years, we're going to see increased death among children. Everything impacts really the health and life of women, the family. And so this is going to have tremendous effects rolling that out. And it's really important to highlight that the damages are not fully visible immediately, but all of these trajectories are going to heavily impact maternal health, cancer detection, and chronic disease, and equity. So this is all very concerning. Go ahead, next slide. We're building a baseline about all the different issues that may arise and that we're going to talk about, but these are, when we're thinking women globally, these are the top challenges and barriers to health. So low, middle income countries, and these are just a few examples, there are more, China, India, Brazil, Thailand. So maternal mortality, skilled care, this is also something that we expect to increase in the United States. We already have very high numbers of maternal mortality among racial and ethnic groups in the United States. We have here, HIV/AIDS, malnutrition, unsafe medical care, limited access to contraception. And then when we move into our high income countries, these are the leading causes. Some of the leading causes of death and top challenges is definitely heart disease. I wanted to, and I have very specific numbers for
Yes.
these. We can also map these out across the United States, what that looks like, and drill down a little bit deeper. So diabetes, breast cancer, mental health disorders. I was looking at data this morning on suicide among women, and it's shocking, but in the discussion, we can talk about what those numbers look like because we don't always talk about that. But I think this is really important. And given all of the changes, right, the inability to take care of your children or provide health services are going to start to drive these mental health challenges in a very increased way. So lots of course, gender bias in healthcare, access to reproductive care. We know a lot of state laws have been passed that do not allow women to receive emergency care. We have put out a couple briefs this year, to advise physicians and give some sort of protocol to understand what types of emergency health related to miscarriage or other types of things. So these are all being affected by these laws. Does that make sense? So a woman goes into the emergency room, she's having a miscarriage, but she's denied care due to state law. And so there's a lot of very, very intricate challenges, and we're going to see that roll out more. And then if you can go to the next slide. And there were so many countries, but 48 countries in sub-Saharan HIV/AIDS. This is when we're talking about AID and all of the cancellations there. These are the top challenges. High maternal mortality, so we're just this increase. It's kind of where those estimated numbers come from. South Asia, Afghanistan. If you're, these are a few of these. These are the countries that are within this group. High rates of anemia, malnutrition, reproductive health, and gender-based violence. And I want to also highlight that this idea and this concept of femicide and gender-based violence is also seen within all of these countries. That does not mean that it does not exist at very high numbers. It just means that these are the top kind of highlighted challenges based on numbers. And then if you could move to the next slide. So these are some of the steps that I want to take and share with this group as we build out, is to build kind of 5 to 10 year models that demonstrate impacts. So we'd be taking all of these different datas and creating models so that we can understand that what women, when they lose Medicaid coverage, what's that going to look like? What's maternal mortality rates going to look like in the next 5, 10 years? And also avoidable deaths among women. And then, so we foresee with these cuts to Medicaid of having very, very significant impact. And it's really important to really understand what these are going to look like, right? So 2025, there were 71.4 million who were enrolled in Medicaid. 7.3 million were enrolled in CHIP, so that's children's health, right? And together cover about 41 million adults. So 23% of the US population. So with this kind of background and this idea, I'm going to pass it to Nushila, who's going to go in depth talking about Medicaid and what these cuts are. I want to leave it right there. So thank you so much. And I will hand it to Nushila, and we will, in our next workshop or even in our discussion later, come back and talk about these pieces there. So thank you.
Thanks, Carmela, for a great overview globally and locally in what's happening. That was a great way for us to segue into what's sort of currently happening right here in the States, because what's happening in the States will eventually impact globally. That's how I always see it. I mean, the US really does impact what's happening in other places all over the world when it comes to healthcare, because so many global individuals live here and because the world is just so interconnected. So, one of the greatest policies that has sort of made its way through the bills and what's going to be impacting us in the long term is the One Big Beautiful Bill, and specifically the healthcare changes within the bill, and how, and specifically now honing in and how it's going to impact women's health. So, if many of you have probably heard of this, you've read about it, we're all pretty aware of several of the implications, probably the broader implications. But I'm just going to give an overview of what the bill is. It was enacted in 2025. It was passed in July 4th, just of this year. And it's here to make a significant impact to managed care organizations, which are pretty much health providers, health plans that oversee a lot of the way that healthcare is delivered and provided to our communities. So think of managed care organizations as United Healthcare, Blue Shield Blue Cross, Centene. So I work for one of the largest ones. I work for Centene Health, and Centene is a national managed healthcare organization, but then we work within different states. So I work within the Health Net initiative within Centene. So for all of us that have healthcare insurance, that is eventually provided by a broader healthcare organization or managed healthcare plan. And the the provisions that are provided under the One Big Beautiful Bill will have huge implications in the way that healthcare will be provided through managed care organizations, and it will specifically impact Medicaid and the Affordable Care Act marketplaces. So, for instance, it will very broadly, it will just cut a lot of funding from a lot of these services. So for Medicaid, Medicaid is seen as a safety net service for across the country. And here in California, we have we have over 26 different Medicaid plans across several different counties, and we have over 15 million people who are enrolled in Medicaid. And the people meaning older adults as well as younger children. And also, it will impact affordable care tax credits. And these are credits that were implemented over about 15 years ago, but it's taken time for states to adopt to have more people enroll in healthcare by giving them lower cost premiums, so that everyone has access to having healthcare access in the end of the day. So, some of the ways, I'm just going to give an overview of the broader implications of Medicaid, then I will hone into women's health specifically. So, one of the ways that Medicaid will be impacted is managed care through their revenue. So, the policy, the One Big Beautiful Bill, is supposed to reduce Medicaid enrollment due to stricter eligibility requirements, including work requirements for certain adults, and changes to eligibility return determinations. And this will eventually translate into lowering like capitation payments for managed care organizations, and then impact more lesser individuals to be enrolled in healthcare plans and services. Capitation is for specifically for Medicaid, it is when you have per member per month enrolling in Medicaid services, and that's how the federal government provides money for Medicaid services, and then the actual state reimburses. So Medicaid is both federal and state funding that's going into healthcare enrollment and services. And when it comes to work requirements, it's not just work requirements, it's also, I mean, work requirements all impact many adults, but it doesn't take into account that many adults are also caregivers full time, that many of them are just not able to work just due to their personal conditions, or people are actually working, but they're just not having enough of that income to support them in enrolling into, let's say, the Affordable Care Act because they can't afford the premiums, or their employer just doesn't provide any type of healthcare insurance. So there's a lot of restrictions that is happening these within this law that's really going to impact a lot of people from just losing healthcare in general. And so we're going to see more sicker populations due to the potential loss of like younger, healthier individuals from Medicaid. And this will increase healthcare costs and necessitate higher capitation rates to maintain financial stability. Now, the way that this will impact healthcare specifically, I have several different um, uh, friends who are doctors, and they're just embracing, and they're a part of different systems here. Kaiser, then you have the Stanfords, and you have sort of the private or the safety net hospitals. They're expecting to see a lot of people actually come in through emergency departments, because the emergency departments are known as a front door of healthcare. So that's their way of coming in, and they're just going to see more people because the emergency department is never going to turn anyone away. But when that happens, you're going to see an increase in individuals using services. And obviously, we don't, there is a shortage of healthcare providers. So it is just going to make the healthcare system even way more hard to manage, and really just struggling. So the long-term impacts is bracing for the long-term impact here. Also, there will be state Medicaid funding reductions. As I mentioned, the way that Medicaid is funded, it's through federal, and then the state compensates for it in order to ensure that Medicaid will be provided to its members, or to individuals who are eligible who need these essential preventive services. And the way that the state Medicaid funding reductions will occur is, well, I can only speak for California because I know some of the ways that we are redirecting our funds in order to support the long-term impact. So here in California, I know that there are certain places where funding is being reduced, like environmental services, and I, environmental is one place that I'm for sure know that that's where the deductions are happening to then provide the funding towards healthcare services so that so that we have at least more money funneling into Medicaid so that it can be provided to our individuals. So California is definitely trying to go above and beyond and bracing for the cuts and also to make sure that our populations here are receiving the services, will be continuing to receive these services. And also something else that's happening because I'm just gonna just to share with everyone. I was actually applying for lots of jobs this past year, and with all the budget cuts, it was very difficult. So, one of the things that I learned from my peers was that, especially in the Department of Healthcare Services, which oversees all of California's healthcare landscape, they were actually reducing several different departments because they're preparing for budget cuts and whatnot. So, there's a lot of redirecting here, a lot of people that are also losing their jobs along the way, which is again being the broader impact that this bill is going to have in the workforce and just the healthcare ecosystem. So there will also be an expiration of enhanced tax credits. And this is tax credits were pretty much implemented to ensure that individuals are given the opportunity to have healthcare access through the Affordable Care Act. And it was holding each individual accountable for having healthcare access. And now that the tax credits will be expired probably by next year as of like January 1st, that will lead to even more higher premiums and drive more enrollment that's lower and of course impact managed healthcare organizations serving the entire market. So we're obviously going to see a devastating increase in uninsured rates. We have worked very hard in America, especially within different states, to make sure that we can reduce the uninsurance rate. And unfortunately, this is just going to make everything go way more backwards. So the combined impact of like Medicaid and ACA changes is definitely going to increase insured rates and lead to higher uncompensated care costs for managed care organizations and also to the broader healthcare ecosystem. So again, this is going to impact the infrastructure, so the operational, so from everything from who is working, where they're working. I mean, I just recently read a few articles um, just this past month and how a lot of people are actually not wanting to work in states where they need where they need the health where they need healthcare providers to offer specific specialized services because of the way that the funding is being provided and because it's restricting them for practicing fully what they have been specializing in. So again, that's going to impact individuals who need these critical services within their states, and either they have to travel somewhere else or they will most likely not get the proper care. Again, as Carmela mentioned, it's going to increase the rate. We're probably going to see an increased rates of people, unfortunately, who are more likely to have higher rates of mortality here or just live in long-term just worse healthcare. And so there's just going to be a devastating impact here. And then we have gone above and beyond to sort of make our healthcare system currently be more value-based, because before it was more you pay for the services that, or the way that the healthcare system reimburses for services is per service that each individual receives. And this past decade, there's been a huge shift into value-based care where the whole goal is to improve the health outcomes of this individual and of communities. However, we're going to see how it's going to really impact value-based healthcare services. And then there's going to be a massive impact in rural healthcare. About 25% of America's healthcare is rural-based, and we're going to see that more hospitals potentially shut down and clinics and providers leaving, as I mentioned, to go practice somewhere else, or just, there's going to be almost like a challenge to see them, or whoever can pay for these services are going to get these services. And obviously all the financial strains are going to make a really big impact in Medicaid cuts, and then leading to even more reductions and closures.
So we're estimating 300 closures of hospitals and clinics, over 300.
Wow.
So states have numbers of how many clinics in rural areas, in urban areas, of who is going to be impacted. So yeah, over 300 across the country, and that's a start. So it's over 300, it's probably around 350 hospitals and primary care. So FQHCs or primary care facilities. Okay,
Mhm.
just wanted to put that there for you. Thank you.
Thanks, Carmela. States, so state specific impacts. So each state is going to be impacted by they're going to have states with larger Medicaid populations are severely going to be impacted. I shouldn't just say large Medicaid, but it's every state. But California specifically, because we're a large state, we have a high rate of Medicaid individuals, and a lot of our Medicaid populations live in the rural communities or the high deserts, and that is really going to uh, impact these specific regions. And we're just bracing for all of the closures we know. I know that there are several hospitals that have been cut funding in Los Angeles County, and they're either near closure or will be most likely closing in the coming years. So there's definitely going to be a long-term impact here for that. And then again, like one of the things that's happening currently is how can each state sort of restructure their safety net programs to meet the new financial constraints. And that's what's being discussed specifically here in California, is how can we restructure our programs and services to meet the needs of high individuals that highly need these services, to individuals that, well, to every person, but individuals that specifically need these services who feel the financial constraint. So I'm going to shift gears to women's health, but I did want to just sort of take a big breath here and also see if anyone has any questions or any comments about this before we shift to women's health.
I have a question.
Mhm.
Nershila, this is Sally talking. What kind of question, since this is very similar in somewhat similar to education funding, I wasn't aware that there is so much
Mhm.
state-related backing of Medicaid. And so if I were to go to talk to some of my legislators within the state of Pennsylvania, what I want to see happening, what is the question I want to ask? What is Pennsylvania planning to do to restructure its support? Give me a buzzword question that I can use, that I can address it to the legislators.
This is a really good question. So I would ask, well, first I would do some background information and just getting to understand, well, how many people are covered by Medicaid within the state of Pennsylvania. And then I would actually ask, well, how many people are covered, and then how is the state of Pennsylvania restructuring their funding in order to support the Medicaid populations? I think that's a great question to ask.
So do you want to take the PowerPoint down just for a minute? We can take a look. This is a really important discussion. And even before we get into women's health, this is a really important kind of baseline. So for example, yes, you want to do a little bit of background research, but hopefully we can provide some of that information or some of those policy talking points here. So for example, the state of New Mexico has 900,000 Medicaid and Medicare recipients. So yes, this is going to tear down the entire infrastructure of healthcare. So we are seeing a collapse. Does that make sense? So 8 hospitals are in the state of New Mexico. We also need to think about block grants and other things that come down from federal funding pools to fund the state. Many states might have, and it just depends, right, Nisha? They're all different, but many
All
of them
different.
will have other types of, what I call this, land-based funding that's discretionary. I don't know, like for example, we sell oil, right? So there might be some pot of funding that they use to contribute to the general fund. They also need to go into legislation, making sure that they are going to buffer a certain area. So I think when you talk with the legislator, having a very specific ask, it could start with one issue or and it might just be knowing that 37 primary care physician or facilities are going to go under. And what is their plan to fund these? And this is the cost. So getting kind of a little bit of that background and coming up with a very specific ask. I think asking legislators needs to be very specific. I think blanket, overarching, they're looking at the same problem, maybe a different dimension of it. So you need to pick your dimension and go, I think, with that. Going with all of it is never very successful. Does that make sense? You're going to want to pick something that you're going to champion. And that's just kind of navigating policy 101. So a lot of people come up with a lot of things, but there's no deliverable. So you need to think of that one thing that is deliverable, whether it's just breast cancer screenings are going to be eliminated. What are you going to do to continue this? This is being impacted in XYZ, but have something so they may have something in their general fund or may have some, related to, because all states generate income, right? So all of them will have, and it might be to start a healthcare fund. It might need to say, we want 27 million in this fund that starts to regenerate itself. Does that make sense? So once you invest 27, you can reproduce. So we need to think about actionable items to offset the cost or to build out pools for the state or for a specific population. And I think that's important to notice that, yeah, that there's different ways of braiding funding. But speaking with governors and others, they're all very concerned. They're very, very concerned, and they need solutions. They need ideas. What's happening in this state? How did they offset it? So that would be really, something to Susan or anyone you could go with and say, this is how they offset this cost. Are you willing to invest in some sort of fund, that can regenerate itself and kind of create, like maybe it's gaming. There's all kinds of different ways that states do that. And so it's really, I'm not familiar with all of the states, but I can give ideas about how education is being funded through these different ways and means. And so some of those models, they work very well. And when there are other ways to use that for care. As Nershila said, we are expecting heavy, emergency room department overflow and all of these other things. So not only do they have to think about people just getting access to care, they have to think about these other very immediate stressors that their health web are going to impact. And even if they have funding to cover, there's still going to be these other influxes in areas that are very different, and they're more on the clinical, right? Like clinical restrictions that are happening because of. So we saw a little bit of this collapse during COVID, and we expect this to be on a different level. Yeah.
Let me just say this. I'm a fairly political savvy person, and I wasn't aware of the state buy-in on supporting that healthcare. And I think just that alone is a very eye-opening. You don't get that when you listen into our local news in across the state. Everybody thinks it's all coming from the feds. And some people are thinking, yeah, well, I think the Fed should cut back. I don't think they understand that whole funding system. And and I think they'll understand it when it's too late. And that's all I was just asking you.
Yeah. Well, and if I could add to Sally also being a Pennsylvanian, we are also in a budget deadlock. So between federal and state issues, who knows what's going to happen. Yeah. But I have a different question. How is this going to affect long-term care?
That's a very good question. It's probably going to make, long-term care is, so let me backtrack a little bit, because by 2030, it is expected that we'll have more populations over the age of 65 than under the age of 18. So all of this I don't even think we've even embraced, like, this whole entire policy and bill hasn't even embraced the fact that we're going to have more people living so much more longer who will need specific home health services, long-term care, hospice care services, and so many people want to age at home. Like, how is all of this going to impact that? And that too, how are you going to not only provide funding, but how are you going, we also need to encourage a workforce that needs that to support them in going into this type of a profession in order to support individuals who are getting older too. And just so I feel like we've only been thinking about this whole entire bill. I shouldn't say we because I don't support it, but this whole entire bill is only taking into effect in how we can slash Medicaid because of the population it serves. And the way that typically it's low income individuals, but it's actually not just low income individuals because Medicaid also has a high churn rate. So people go in and out of it when they're not working or when they are working. I mean, in COVID, we saw some of the most wealthiest people go into Medicaid because they lost their jobs, their company shut down. So it gave us a really big perspective of who are the populations actually using it because did a whole, because before it was just created as a safety net to support women, children, maternal and child health care, and then it eventually expanded to provide more individuals who are between the ages of 18 to 64 at least access to healthcare services. In the state of California, we also adopted that if you are undocumented, you can still use Medicaid services. This was implemented about 3 years ago or something. So, so that gave more individuals access if they needed healthcare service. Again, the goal of healthcare is everyone, it's a human right. Everyone deserves it despite where you're from and despite your background. So right
So,
now, I
oh,
think
go ahead.
that, oh,
I'm
sorry,
sorry.
the implications of long-term care, I believe, are haven't been really thought out in all of this because we're just so focused in where to slash prices and costs.
So I expect long-term care to end. That's it.
Mhm.
Well,
I expect there to be significant challenges and for it to come. We don't need to see all of the map that we have right now of what is included in long-term services and how it's covered. With this going away, it's not just the way that Medicaid maybe is not paying, it's the closure of clinics that produce and that serve and that are there for long-term services. So they are already underfunded. They're
Mhm.
already challenged. Does that make sense? So they
oh,
are
yeah,
already in a deficit.
yeah.
So you can think about massive closures and non-existent services. Does that make sense? Okay. So
Yeah, and
even
it's
those
very,
there you go. Yeah, that's your,
yeah,
that's,
considering I have family in the long-term care. So,
and it's
um,
extremely expensive,
It's
right? To
very
keep family.
expensive.
yeah,
Yeah.
well, she's
Yeah,
on Medicaid. And
Yeah.
I know all of her lady friends who sit around the table every day, they are really, really concerned. Um,
right,
because they hear about, oh, you have to work. Well, how does
right,
someone in her 70s who's legally blind work?
right.
So anyway,
So,
yeah,
so
but it's scary.
that's a great place to advocate to a state about long-term care.
Hmm.
Like we already see this in a deficit. We already see the challenge. We already know that this many people, and by this, like you have that. That would be a great place to start. So your state is gonna. This is what's gonna impact, right? This is gonna. You can kind of almost do the numbers. If you have a facility, a long-term facility in Pennsylvania that has 100 residents, and they're in term, and you can kind of um, calculate out what this is going to look like, what that closure would, so and we also have to think about what was it like before. So before the expansion. So we also have those types of numbers and facilities and kind of a roadmap of, okay, and which ones, so we can almost going, we're going back 100 years, but we're removing these expansion areas. And so we do have kind of a roadmap. What was it like prior? Did the expansion
Mhm.
put additional stress on healthcare systems? How did they manage that, and what did it look like before? So I feel like there's some room to kind of study and look in between and kind of have an understanding. I do know that long-term services were not priority during COVID, and so there were a lot of different agencies really reaching out and trying to provide, but you can see what happened and how these facilities were impacted, right? And so that's not part of the narrative, and it's really important to elevate long-term care as a priority for the population. That is really important.
Yeah.
That is not part of the conversation right now. So I really fully support, illustrating the need for that. And because we're going to see this massive increase.
Thank you.
Yeah.
I think Faye Weber has her hand up.
Oh, go ahead, Faye.
Okay, well, right now, we have an impending government shutdown because of the healthcare issue, and that's how important it is at this point to the Democratic Party to be willing to shut down the government funding because of the healthcare issues. And to me, it isn't just a Democratic issue. I think there are even more Republicans that are in the program than Democrats. And do you see any hope that this program can be revised? And before you answer that, I just want to say this is one of the best workshops I've been to in years. Your knowledge and information, both of you, are just fantastic. Thank you so much. So the government impending shutdown, is it possible it's going to affect this healthcare in the United States?
Yeah, I'll just take a quick step. First and foremost, thank you so much, Faye, for your question. I I just want to start off also by saying that understanding the healthcare system in America is so difficult because it operates. It really, and I work in healthcare. I work for the largest managed healthcare organization right now, and I'm still trying to wrap my head around policies, and I have so many questions. And it's also because it operates so differently state by state. So all I know, I'm just so much more versed in California, whereas I don't know New Mexico's situation. That's where Carmela is based, or Pennsylvania or Montana. I saw some questions about Montana, and this is something that we need to get more data on and much more understanding of. I feel like there is data from pre and post, but there's definitely there's still so many gaps to understand, and I feel like it's really hard to kind of predict also what may be happening. There will be closures. But where are these closures going to happen? Definitely in rural areas. How much of it is going to happen in urban areas? How much will it happen in California and different counties? So I feel that there is just so many questions to have that I personally also have, and there is a lot that we need, that a lot of us, as Sally mentioned, we just don't understand how the healthcare system operates. We just know that we have healthcare insurance and it comes from certain and so places. We don't understand what type of insurance. I think a lot of people in the US don't understand that there is private insurance and public insurance. Medicaid is a public insurance service, but Medicare and commercial are private. How you get them, how it's functional, how it's operational, and how it's funded. So there's a lot of knowledge gap here, and that's why there's so much also. Just the discussion for healthcare services is really challenging and difficult. Carmela, would you like to add?
So I work within the healthcare system, and I can tell you how this thing works. I know you're recording this, so I'm going to have to hold back in explaining some of this. It probably takes a lot more time anyhow. So this shutdown is going to have devastating effects on our system. And unfortunately, all of the great individuals who work within the system to keep it running. We're also challenged with staffing shortages at the federal level. So being able to administer programs and challenges and keep this whole thing moving. The system is not necessarily a system. It's full of many systems. So there are different systems throughout the US, and they are not all in conversation with each other. But the safety and the nets of all of these can be yeah, we can see that this shutdown has mass implication. It also is tied to a RIF, which would remove other healthcare workers that we've kind of what we've seen in the past. You guys know what a RIF is? Okay. So where these mass firings across the government. So that's, you know, SAMHSA, CDC, you can kind of, so this is tied to that. So not only are you going to see, yes, Medicaid, but this right now is also, there, you know, we're probably expecting people to be let go from their positions. So those are
Yeah.
the ones that keep it in the background running. Does that make sense? So yes, this has mass implications. In fact, we there are layers of challenges. That's how I want to put it in nice. There are many layers. So, you know, on the ground, getting services, but actually keeping functioning systems throughout the US is already challenged tremendously. And right now we're going to see a collapse of that. That's what you're gonna,
Mm.
yeah. And I don't mean to be so bleak but it's a number so you can calculate. And once you just see that, you know that the effects are very, very, are going to be very harsh, very, very harsh. Yeah. And we have Laura. Is it Laura?
Yes, I just wanted to point out, it's a piece of the puzzle that I don't think everybody understands, but our personal health insurance payments relate back to what the Medicare and Medicaid rates are, as it all runs through CMS and payment services. Hospitals get told to bill at X rate based on Medicare and Medicaid rates, and those end up being the basis for how your health insurance pays as well. So those rates are important to all of us, whether Medicare and Medicaid are important to all of us, whether or not we are users of those programs or not. Our costs in terms of our deductibles and our copays all run off of those same figures. So don't let people tell you that, well, you aren't poverty stricken or aren't on Medicaid. That doesn't impact you. It does. And so, I don't think any of us understand the complexity of how that billing works behind the scenes.
Exactly. Yeah. It's a very complex billing system, the whole claims and encounters, and it operates so differently between state by state, again, the way that the funding or the payment system works. I'm not a part of that particular part of the managed care organization. I work in more around health equity and regulatory and compliance, which is a whole nother conversation. But yeah, it's very complex and complicated system, and that's what's going to be massively hindered. All right, should we just, it's 9:55, so I will wrap up our conversation, our presentation here, but I just, I guess, oh, I just pulled up some fact sheets on Pennsylvania here, which Sally I'll share it with you so you can look at it. Okay, so just going into women's health, there's going to be massive implications to women's health once Medicaid, the cuts are already impacting so many different areas. So there's the law roughly will cut about $1 trillion in Medicaid funding. So this will specifically impact women who right now comprise over half of the adult Medicaid population, and specifically it will reduce coverage for low-income individuals, including pregnant women and new mothers who specifically are one of the large users of the program, but not large users. This program specifically covers for a lot of services for pregnant and new mothers. There's also going to be a loss of funding for Planned Parenthood. The reimbursements will most likely not support a lot of healthcare nonprofits. Not Planned Parenthood is a nonprofit organization that supports so many different preventative care services for women's health, not just abortion services. They provide lots of different kinds of care services, and they are the greatest targets of this funding deduction. So, oops, let me just, what happened here? Also limiting the Affordable Care Act, specifically limiting the funding from the Affordable Care Act also cuts back on uh, providing essential services like abortion care. And we all know what that looks like throughout the states right now. And this gives insurance a strong incentive to weaken or drop abortion coverage from the Affordable Care Act system. So a lot of coverage that are essential for women's health, that are preventative, that support the life, pretty much the life and death situation for women, depending on what circumstances they are in, it will most likely be dropped. And again, it will have severe implications in the way that coverage is provided within the state, or completely drop it where women don't have access and they have to either travel somewhere else, or we just know the impact, or just the implications will be unbearable. And also specialists who were trained in this will no longer be able to serve this population, and they will be leaving these specific regions. Specifically, maternal and child health cuts are going to be uh, deeply, deeply impacting women and family. There's studies that are showing that Medicaid coverage extensions for postpartum care, which are effective at reducing maternal mortality and addressing maternal mental health. Now, this will definitely worsen, and specifically, specific populations will be impacted by this, like the Black individuals, and Indigenous populations, and again, rural communities. I want to mention that more broadly, there will be other populations too, but specifically, these populations will be highly impacted. I mean, as I mentioned, preventative care services for women across all our life stage changes will certainly be impacted by the cuts here too. And it will not only impact Medicaid, it will also have implications on commercial health insurance access too. Remember, when there are more individuals coming in through the front door of care, emergency department services, and then when, I'm just going to give an example, someone like me who has employee health and I have an emergency situation too, the systems will be just so constrained that it will be very, very difficult to get services. So it will not only impact what's happening at one population, will be certainly having a spiralizing impact on other populations too for the long term. Okay, is that? Oh, this is, I just put in, I was trying to look at some data specific that has been published, and the Kaiser Family Foundation has some really great just the long-term impacts of not the long-term, but how the federal funding is being allocated under the One Big Beautiful Bill, and where it's actually going to decrease. So this chart sort of shows here in green where a lot of the funding cuts will decrease, and you can see here the Affordable Care Act, Medicare, Medicaid, they'll all be impacted, as well as food assistance services and just access to healthcare insurance.
Hmm.
And that pretty much wraps up my presentation section. I did have a section on, I did have a timeline on when all of these different provisions are going to take into effect, starting from July 4th of this year to the coming years ahead. I'll just drop that in the chat and you guys can look at it. But I was actually trying to look at a lot of like specific numbers that were published, especially through like Kaiser Family Foundation, because I really just go there for a lot of data information, but I couldn't find anything on the long-term impact. So Carmela, if you have that information or anything like that, I think that'd be really useful for us.
Thank you everyone for having us today, and we look forward to our future workshops. So, Ndawaha, thank you.
Mm.